Everyone, thousands of planes grounded as the coronavirus pandemic continues to go across the country. It's hitting airlines especially hard. The head of the nation's largest pilots union wants airlines to adopt some safety protocols, though, before resuming business as usual. So joining me this morning by Zoom is Captain Joe DePete. He is president of the Airline Pilots Association. Thank you, Joe, for joining us.
Jim, thank you very much. I appreciate you giving me the opportunity to come and speak to your listeners.
So at this point, let me ask you, how many of your members or how many pilots do you know of that have been tested positive for COVID-19?
That's a good question. So we've had over 300 pilots. We believe that we're testing about double the average right now. And so we have some obviously deep concerns about that. We've also had 3 deaths to date. And so obviously it's a concern.
So let me ask you, are airlines alerting other crew members that are coming in contact with these pilots? Are they telling passengers? Like, what's the protocol here?
Right. Well, you just got to the heart of the question here and why I'm on today. Right now, there's a set of guidelines that were put out by the FAA. They basically are CDC guidelines. But what we needed to do was to have the FAA do their job as a regulator, like we do our jobs as pilots, and mandate those rules, right? It makes no sense when dealing with a pandemic to have a varying patchwork of compliance with all the airlines, where some airlines do a really good job, some airlines do not such a great job. The virus doesn't care whether you did a really good job in one area and have a gaping hole in the other, right? And so we need a mandated, standardized approach to dealing with the COVID crisis.
Well, let me ask you, the CDC is recommending people stay 6 feet apart from one another. Right. You can't do that in a cockpit. So what are you advising your pilots to do?
Yeah, well, there's a set of guidelines that we're looking for right now. Now we've been asking for, because we are essential employees, right? We keep the flow of goods and services coming over from China, for instance, right? All the ventilators and the masks and everything like that. So we have to take extra precautions, right? So now we're asking for increased amount of personal protective equipment. We're asking for tests, right? Testing to be done on a regular basis, cleaning and disinfecting our aircraft on a regular basis, and all this will go a long way to helping curtail the spread of the virus.
Well, you were saying a patchwork. The airlines a few days ago said, passengers now have to wear masks.
Right.
One Frontier at one point said they were going to charge people to keep the seat empty in the middle. I mean, are these things a little, too little, too late at this point?
Well, that's the whole point, right? And I agree that they should have done this earlier. We started way back about mid-January. We saw this coming from Europe, even when people were telling us it wasn't going to be a big deal, right? We heard certain people saying in high offices that this was not as serious as it is. But we got started early. We started to work with our carriers to develop agreements to help curtail the spread of the disease and to adjust ourselves in terms of manning levels. So it is really serious. And what we're asking for here is something that I'm very used to as a pilot and as a former Marine. It's called leadership, right? Leadership in a crisis. You can't do this in a whack-a-mole style. You have to tackle this thing with a standardized approach. And it seems like they're playing hot potato right now. They're all passing it to different agencies, saying it's someone else's responsibility. And that's not going to cut it.
Well, let me ask you a question. I was a flight attendant in the 80s and 90s before getting into news full time. And, someone would cough and sneeze in row 15. And 2 days later, I came down with some kind of bug. I knew it was coming.
Absolutely.
What do people have to understand, passengers have to understand about the environment inside of a plane?
And you just hit to the core question. What are we going to do to restore confidence, right, for people that have to fly right now, right? I mean, we're moving people, healthcare workers, back and forth to hot spots all around, and there are people that have to travel. So the basic thing would be we need people to wear masks, right? We think of masks. We've studied the airflow and types in these aircraft, and actually airflow inside an airplane can be helpful in some ways in curtailing this if you're wearing a mask, right?
Yeah.
And so that's really important. Also, there's been talk about testing, right? Non-invasive, non-touch testing using temperature guns and things like that. I remember that during the SARS epidemic. We had to have, testing like that going on. So there's a way to do this smart, and there's a way to do this safe. And remember, pilots, we make a decision as to whether it's safe to fly every single day. The fact that those airplanes are taking off right now means it's basically safe, okay? But the question is this: Are we doing all we can, right? Are we eliminating all the risk? And here's what it is. Right now, because the FAA refuses to act, we have additional, unnecessary, and preventable risk, and that's unacceptable.
Well, and you know what? As a result, people are not booking flights. They're sitting there
Right.
going, okay, I'm just
Right.
going to stay at home. Look into your crystal ball.
Yeah.
When do you see this possibly, returning to normal, if when?
Right. Well, I mean, we're getting the same information to you. We have a bunch of medical people on our staff, and we get briefed on these things all the time, and they're in contact with everybody, including worldwide, right, through the International Civil Aviation Organization. We're even involved in that. And, there's so much we don't know about this virus. And I think we're going to learn more and more as we go on. But I know what we can do right now with the information that we have now. And we just need to be on our toes as leaders and make sure that this stuff gets implemented. I mean, honestly, the Airline Pilots Association has a plan. And it's really called, it's a public safety corridor, right? Where you come to an airport that's prepared. You get on an airplane that's been disinfected and prepared. You have flight crews that have been tested and have the personal protective equipment. And so it's a holistic approach, right? It's a standardized approach. You can't do this in a piecemeal way.
Well, Joe, we appreciate you taking your time. Captain Joe Peter, the Airline Pilots Association. Please stay healthy and stay safe, sir.
Same to you. Thanks a lot for the opportunity. Bye-bye.